Hi, I'm Genevieve Dicing with H&HN Magazine. I'm here with Dr. Jay Shannon, CEO of Cook County Health and Hospital System. Thanks for being with me today, Dr. Jay Shannon.
It's a pleasure, Genevieve. And I think one of the challenges, as I alluded to earlier, is that when you talk about an individual who's not a healthcare professional, many people have said, you know, what those individuals are really looking for when they get healthcare is three things. They're looking for quality, they're looking for safety, and they're looking to be treated well. And it's easy for them to understand when they've been treated well. I think it's very, very challenging for the average American to figure out or assess, either in an anticipatory way or after the fact, to assess the quality and the safety of the care that they receive during an episode of care. But they can sure understand if they were treated well. They can surely assess whether the place that they got service was timely, whether it was clean, and things of that nature. So we as an organization are in the midst of a transformation that was really brought on by the Affordable Care Act. We've gone in a very short period of time, the space of about 4 years, from an organization that took care of a majority uninsured population to a majority insured population. Today, about 2/3 of the people that we care for have insurance, and that's quite a different proportion than it was before the Affordable Care Act. When I'm talking with our staff, what I tell them is that means that those 2/3 of the individuals that we care for not only bring reimbursement into the system, but they also have choice. They can go anywhere that they want for all intents and purposes in the area for their care. And we need to earn their business rather than to be thought of as an organization that's the healthcare provider of last resort, which before the Affordable Care Act, many of the folks came here, that was kind of their only opportunity for care. So because of that, we're trying to go through with our staff and make sure not only that we're doing those things that are difficult for the patient to understand, making sure that we're adhering to best practices around quality and safety, but that we are also trying to provide services in a timely fashion, in a way that's respectful, that is caring, that is culturally competent, that we're doing it in a clean environment. You know, and those are an ongoing challenge for our organization. But the other piece that the idea of consumerism alludes to is not quite as big a challenge for our organization working with the population that we serve as it might be for others. I think that there are some things that are wrong in our country about the way that healthcare is done. And one of the concerns that's driving the Affordable Care Act, it's certainly a motivating element of the triple aim, is that we cannibalize other opportunities in our country by the amount of money that we spend on healthcare. So we are, as I think your listeners know, the leaders across the world in the amount of money that we spend on healthcare in this country, and the dollars that we spend on healthcare are at some level certainly needed, but those are also dollars that could otherwise be going to education, to social services, to infrastructure, and elements like that. Some of the acceleration of those expenditures, and why we are the leader in the developed world of spending money on healthcare, is related to pressures that have evolved over the last few decades to make healthcare a capital growth industry, and that includes things like unbridled direct-to-consumer advertising. It includes things like pressures from organizations or big pharma to medicalize certain things that are actually just conditions of human living. But if you can categorize it, get it to be an ICD code, then maybe you can bill for it, and you can make people feel like their life would be inadequate if they didn't address that. And so for many people, I'm not a huge watcher of television, but when I'm watching the Olympics, I watch television. And I'm struck by how much direct-to-consumer advertising there is around real or perceived maladies that the American public supposedly suffers from. In addition to that, you see competition in advertising for different kinds of drugs. And so you might have a situation where a person has a problem that would easily be cared for by a low-cost generic medication, but if they have seen the splashy new expensive medication, they may ask for those kinds of things.
For H&HN, I'm Genevieve Dicing. Thank you for watching.